If you've been doing all the stretches for your hips and your knees and your hip pain and your knee pain isn't quite going away, do this exercise to get control of that new flexibility. Dr. Nicholas Mercer with you, Improved PT. So a lot of people will have some knee pain or some hip pain associated with femoral acetabular impingement, basically hip impingement, labral tears, some other different types of, hip pathology. What will happen is you may do some stretches, you may get a little more mobile, you may feel like your hips have more movement in them, but we're still getting pinching or we're still getting knee pain during some more athletic movements where we're involving hip hinging, turning like this. We may get some pinching in the front or on the inside of the leg, the inside of the hips, and on the in the knees, because we're getting a lot of rotational stress through the knees because we can't control the rotation in the hips quite yet. So what I'm going to show you is a simple exercise that you can do to help control that new flexibility you have, so when you are going to do these athletic movements, or even when you're just walking, climbing stairs, going from sitting to standing, squatting, whatever you need to do where you're feeling this pain, we can take some of the rotational stress off the knees and allow us to use that flexibility so we're not pinching in at the hips. So this is another concept where we want to look at, flexibility versus mobility. Flexibility means we have the ability to lengthen a muscle. But if we don't have the mobility, mobility would involve being able to control that flexibility so that the joint moves better. If we don't have that mobility, we're still going to get the pinching, the pain in our hips or in the knees, depending on where you compensate. So what we're going to look at is a standing exercise, and what we'll start with is, if you're standing one leg forward, one leg back, we're going to be focusing on the front leg. And what we're really going to focus on first is getting the movement right. So we're not going to make it very challenging at first, just so we can get that movement. So what you're going to do is hinge forward, right? So if you'll see here, I'm keeping my back straight, bringing my chest forward, bringing the hips back, right? And so if you're already getting pinching here, that's a sign that we're not quite able to use the flexibility. So what we're going to do, and you'll see this a little better from the front, we'll get into that position. Most of the weight on the front leg, maybe like 20% of the weight on the back leg, most of the weight on the front leg. We are going to, if you put your hands on the sides of your hips, kind of where your hip bones are, we're going to turn and drop into that hip, right? And go as far as you can. You should feel some pulling, some stretching on the back of your hip, and maybe some activation in your groin here, but we shouldn't get a lot of pinching. If you're getting a lot of pinching, we need to work on that flexibility before we go into this exercise. And from here, we're actually going to turn and try to push that heel down. You should feel these muscles on your hip working until we're turning out, keeping that knee pointed forward, but letting the body turn out like this. Again, only about 20% of your weight on this back leg. We're going to come back in, allow that hip to drop back, and then pushing through, rotating, keeping that knee pointed forward, turning the body to the side. So we're working a few things here. Right here, we're working a little bit of adduction of the hip with internal rotation of the hip, and that's why we're feeling it more of a pull of a stretch in the external rotators in the back of the hip. And from here, we're working into external rotation and abduction of the hip. And here you'll probably feel a little more stretching on the inside of your hip and some tension on the outside of your hip. So we'll do that a few times, and keep in mind we don't want to feel pinching through here. So we want to keep that back nice and straight. Okay? And as you progress with this, you're going to do the other side. I'm going to do my other side now so that I'm even. We're going to drop back into that hip. We're going to turn out. My right side is actually a little bit harder. All right, so most of my weight is to the front. Yeah, I'm shaking on this right side. My right side's not quite as good as my left. Driving that heel down, turning out, keeping that knee forward, turning into the hip, and then coming out. Okay? So that's kind of the novice, right? That's the beginning stage of this exercise. The next step is actually going to be lifting the back leg up, really getting that balance here. Again, only if you can hold this position and we're not forward like this. So now lift that leg up, and now we're going to drop into the hip. This is going to require a little more control. That's why we didn't start like this. And then we're going to turn out, coming up. Okay, coming back down, letting those hips turn in, and coming up. All right, we'll do that on my other side too. We'll see if I can hold my balance on this one. All right, I'm going to drop into that hip. I'm going to come up. Okay, that wasn't too bad. We're going to drop into that hip. And we're going to come up. Yeah, my right side is not so good. So you will probably find that one side's a little harder. So this is a pretty significant progression. Again, if you need the flexibility first, if you're still getting pinching with this exercise, check out, I'll put a card up here. Click that link, it will take you to a stretch that will help get those tissues a little more flexible and ready to do this exercise. But if you do feel like you've gone through that flexibility exercise, you've really starting to feel like your hips are more mobile, do this to start controlling them, and then using mindfulness, so acknowledging this is what my hips rotating should feel like, incorporating that into the movements you do during your exercise, during your workout, during your everyday life. So for instance, if I'm going to come down like this to try to pick something up and I feel pinching, I'm going to reset, try to get that better position. As I come down, sink back into the hip, and wow, I don't have pinching there anymore, right? So using that practice of mindfulness to incorporate these movements, these end ranges, and this control of the hip rotation, abduction, and adduction in order to prevent that hip pinching through your everyday life. So if you are struggling with hip impingement, labral tears, or even knee pain that is kind of secondary from these hip problems, please go to youimprovept.com. Let us know what you're struggling with, how we can help you, and go to youimprovept.com also for free resources on ending lower back pain, hip, knee pain, various different types of pain that you may have, either primary or secondary to that hip impingement diagnosis. So let us know how we can help you. Go to youimprovept.com for more free resources and get ready to improve your movement and improve your life.